I'm Dr. Shirley Hartman. I'm a family physician in Jacksonville, Florida, in one of the areas in which I specialize is in Lyme disease. So I myself am recovered from pancreatic cancer, and 20 years plus before that I had lymphoma.
My question will be, what would you say to these people that are going through cancer, and especially a cancer like yours? What would you tell them when they're feeling out of hope or when they don't know what to do?
So when I got diagnosed with pancreatic cancer, I chose to do only holistic alternative treatment. And for a while I held my own, but after a couple of months, the cancer had clearly grown from 1.8 centimeters to 1.9 to 3.2 centimeters. So I had been doing nutritional treatment with pancreatic enzymes, natural cancer killers like IP6 and Brazilian mushroom, Agaricus blazei, and green tea and turmeric, IV vitamin C, hyperbaric oxygen. So when the tumor was clearly growing, I connected with Cancer Treatment Centers of America and took the chemotherapy for 4 rounds of one kind and 2 rounds of another kind, and then I had the Whipple surgery because I believe I was so nutritionally supported. I did extremely well with the surgery. I was discharged on the 4th post-op day. I didn't have any cancer extending beyond the margins that were removed other than 2 lymph nodes. So I didn't have to have radiation therapy, but they recommended doing chemotherapy again. So I got retested from a company called RGCC that does a circulating tumor cell count and that can also test for sensitivities to chemotherapies and sensitivities to natural compounds. So I knew that what chemotherapy I was using would work, and I modified my nutritional supplement regimen, continued my IV vitamin C, my hyperbaric oxygen, my diet, my supplements. After 4 rounds of chemo, I felt that I really needed to have a break. It was putting me under. And so I got permission to take a break from the chemo because I was supposed to have 4 more rounds. I got another circulating tumor cell count done, and it was 0. So I told the oncologist, I felt like I'd had enough. He still recommended that I do another 4 rounds. I told him he could take the another 4 rounds if he wanted them, and I wasn't going to take any more. My circulating tumor count is 0.
But because you were doing all the other things too.
Exactly. I mean, the doctors were amazed at how well I had recovered from the surgery. I was out of the hospital on the 4th post-op day. The oncologist just looked at me, couldn't believe how good I looked. He goes, "You're a week out," and typically when I started, people were hospitalized for 2 weeks for this surgery. So, I really believe that I did very well with the surgery, and post-operatively I did very well in terms of clearing the cancer because of all the nutritional things that I was doing, the diet, the supplements, the IV vitamin C, the hyperbaric. So I've now had 5 circulating tumor cell counts come back 0. All my scans are 0. So I am recovered from pancreatic cancer, which overall has a 10% 5-year survival. For somebody with a good prognosis, 20% 5-year survival. So, once again, I beat the odds, and once again, it's so important to put the right things into your body so that it can do what it needs to do for recovery. It's important to blaze your own path. You take information from doctors and sources, and you listen to the voice within and make a decision about what your best path is. In the statistics for cancer patients, the people who simply do what the doctor says are the group with the worst prognosis. The next worst prognosis group are the people in denial, where it's like, cancer? What cancer? So, that's telling the immune system we don't have cancer. But the best prognosis group with cancer are the people that don't just take the doctor's word for it. The people who research, who study, who find other options, who are a pain in the butt to the doctors that say, is there anything else? Is there something else that I can do? The people that, research and find other options. The people who read and study and who take a different course than strictly conventional. Those are the people that are going to recover better. So your results are often going to be proportional to how much you think outside of the box and how many things that you add in to support your body to be able to shift physiology in the right direction and things that are going to help kill the cancer cells and support your well-being, because you have to be able to survive the cancer.